system is facing serious questions again. And once again, the victims are children. More than 130 people, most of them children, have tested HIV positive in connection with an outbreak linked to government-run hospitals in Karachi. Across the country, children keep testing positive for HIV, not through birth, not through their parents, but through the very clinics and hospitals meant to treat them. And this is not a one-off tragedy. It's a pattern that keeps repeating year after year in different cities, different hospitals, always with the same root cause.
It was shocking for me. I was astonished at the time that in a small baby, only having history of doctor's practices, why she has got this HIV. So, and after coming to know that she has HIV, I made my practice routine to go for the screening of each and everybody who was having same symptoms.
Once screening starts, the true scale always comes out.
In 2 months, I had found 20 cases, all those who are having the same history, all those who are having the same symptoms, and they all were positive for the HIV.
That is the pattern investigators keep running into. Government inquiries keep pointing to the same failures: poor infection control, careless handling of protective equipment, and single-use syringes that clearly are not being used just once. Investigations keep confirming infections in the dozens and child deaths, with medical staff repeatedly named as responsible. And it's never confined to one facility. It surfaces again and again in public hospitals and private clinics alike, because the failure behind it is never actually fixed. Families living through this describe the same shock no matter where they are.
I got my daughter tested. They confirmed that she was HIV positive. It could be contagious to all my children. My husband and I are HIV negative, but my daughter has the HIV virus.
That single sentence explains how this virus keeps spreading in Pakistan. Parents test negative, children test positive. That only happens one way: through contaminated medical equipment, not through childbirth. Health officials confirm the same story every time an outbreak gets investigated.
आज के दिन को छोड़ के बाकी 9 दिन की स्क्रीनिंग बताते हैं.
In the past 9 days, we have tested 4,703 people. Of them, 185 are HIV positive, and the large number are children.
उसमें ज़्यादा बड़ी तादाद जो है बच्चों की.
So what's actually driving this nationwide? A healthcare system that keeps cutting corners at every level. Syringes and IV drip sets get reused across public hospitals and private clinics. Health workers puncture the same medicinal vial with the same syringe body over and over, and even with a fresh needle that contaminates the vial itself, exposing every patient who gets medicine from it afterward. In under-resourced areas, unregistered clinics run by untrained practitioners operate with zero oversight, reusing equipment and recycling medical waste just to cut costs. There is also a cultural factor, a widespread belief that injections and IV drips work faster than pills. So children with routine illnesses like fever, cough or diarrhea get unnecessary jabs, and every extra jab is another chance to hit a contaminated needle. On top of that, blood banks across the country routinely fail to screen donations properly, putting children who need transfusions, especially those with conditions like thalassemia, directly in harm's way. Pakistan already carries one of the world's highest burdens of hepatitis C, a clear warning sign of how deep these infection control failures run. And once families are infected, the system abandons them just as badly as it infected them.
There is a marginal improvement in her condition. She is still suffering from fever with chest congestion. The government does not give us Septran. No multivitamins are given to us. What kind of help is this from the government?
No medicine, no follow up care, just silence from the same system whose negligence caused the infection. And for families without money, even basic testing is out of reach.
वो प्राइवेट में लिखी देते हैं, प्राइवेट में पैसा नहीं है, हम
They suggest that we get medical tests from a private clinic. We don't have enough money. We have to take care of feeding our family. How can we pay for this treatment? I don't have the financial means for ultrasound tests. Not only me, but all the villagers are poor.
सारे गांव में जो सब गरीब मिस्किन लोग हैं,
The national numbers confirm this is systemic, not a string of isolated accidents. The WHO says Pakistan now has one of the fastest growing HIV epidemics in the region, with infections up 200% in 15 years. Around 350,000 people are living with HIV in Pakistan, and nearly 80% don't even know it. Among children, infections have more than tripled in the past decade. Yet only about 38% of HIV positive children are getting any treatment at all, and only a small fraction of pregnant women who need therapy to prevent transmission actually receive it. Diseases spread when healthcare systems fail to protect people. Every reused syringe, every ignored safety protocol, every unregulated clinic carries a human cost. And in Pakistan, that cost keeps falling on children who never had a say in any of it. That's all in this edition of Connecting the Dots. We'll see you in the next episode with more raging issues. Until then, it's a goodbye from all of us in the Delhi newsroom. This is Munmun Bhattacharya signing off. Take care and stay safe.